My name is Dave Coach and I'm the director here at Johnson County Public Health. You'll see additional men that work here at Public Health explaining what men's health means to them. But to me, there's various aspects to men's health. Certainly eating right, and as I age I realize the importance of eating properly, so I try to really reduce the amount of sugar in the processed foods and look to more organic produced, locally grown foods. Also physical health is very important to me, so I really try to both cardiovascularly as well as mentally be as strong as possible. And I do that through just being outside, walking with my wife in the evening, cycling and jogging. And also it's important, I think, to really be aware and have men aware of the preventative aspects to men's health, and that may mean proper screenings for different types of situations that arise. I know my father passed away several years ago from prostate cancer, and so that's just one of the things that I'm more aware of as I age as a male as well. So all of the other men that are speaking, and take note of your own health and do what you can to stay healthy.
My story is last summer I got a physical from the Dr. Elizabeth Loeb office, and she identified the fact that I was pre-diabetic, and that really concerned me. And so instead of reacting, I was proactive in getting signed up for the Federal program, which is a physical fitness program that is Monday through Saturday. And with that, I lost up to 20 pounds of weight, and in addition, I drink half my body weight in water daily, and this is referred to as my Bubba partner. And I come in the morning and I fill that up, and before I leave I know that I've had at least less than 64 ounces, and then add to that in the evening. Also, it's all about optimizing my health in the weight, not only of weight but also for what I eat. And I'm getting more into eating more nutritional healthy foods and less unhealthy foods. And it's a daily journey and it's a daily habit. And I think that each and every one of us can mirror back to ourselves, and I ask the question, how do we want to change? And do we change this day or this week or this month or this year? Or do we react to something that we can be proactive in? So I think that all of us, as far as men are concerned, we all have it in common. We age, we get older, we live, we die. So how do we want to live until we do die? You're the gift, and within that gift, you occupy a certain amount of space. And with that being said, what kind of energy do you want to bring as you age? Do you want to bring positive or negative energy? So it's up to us to make that decision, and if we're going to be in control about our world and our life, optimizing our health in mind, body, and spirit is really truly the ticket to a great gift.
I think having someone in your life that either your wife, girlfriend, significant other, having someone that kind of holds you accountable for to make sure you're eating healthy and staying physically active is a major role in me being healthy and active.
So one thing I've noticed as I've gotten a little bit older is whenever I go to the gym, it takes my body just a little bit longer to recover, and I'm a little bit more sore after a workout. So something I like to do is make sure that I stretch really well beforehand, but after I do any really strenuous activity, I like to end the workout with something light like ping pong. Something to just help my muscles recover, relax, and get rid of some of that lactic acid so I'm not quite so sore the next morning.
Some of the ways that I stay healthy are cooking my own foods, preparing my own meals, trying to eat raw and real food as opposed to processed foods. I typically am active in some sporting event 2 to 3 times a week. I like to go biking, kayaking, especially in the summer, stay active in any way I can. Yard work, spend a lot of time in the yard. At work, I usually go for a half-hour walk during my lunch break. There's a trail not too far from the office that I like to walk on, and try to I have a standing desk that helps, you know, and just be active, not be stationary.
Men's health means to me, I just believe in personally being healthy. I want to take care of my body. I want to be as healthy as I can for as long as I can. So I think it's a personal choice to live a healthy lifestyle, what you eat, how you work out, incorporate that into your life, even when life is busy and there's not a lot of time to make time for exercise and good, healthy eating.
So when I think about what I wish I would have done more when I was younger, as far as my health, I'd like to have had more information about my sexual health. As a young gay man, I was in high school and college throughout the 1980s, and that's right at the time when AIDS came out. And at that time, all I really thought about was being gay meant you got AIDS, AIDS meant you were going to die. And I'm sure there probably were resources out there that talk more about safer sex and such, but I didn't really connect with them much. The information I got was some other guys or people or what. It just wasn't always professional. It wasn't always accurate. And it was later on in the 90s when I did hear more about things more formally. And actually, another part of this as well would be if I'd had more information about healthy relationships too. So fortunately in the 90s then I did get more information, talk more to people, had more of a means also to find things. And I think that it was hard back then because I didn't really know where to find things. And now I'm glad that there are things like the internet and people are actually talking more about things. There isn't as much stigma about things. Even in small communities like where I grew up, in small communities, people didn't really talk about things and people are talking now. So I'm really glad to see that. And I would say to anyone who's at any age wanting to know about things like sexual health or topics that aren't discussed very much, to actually look for ask questions and look to your experts, search on the internet, and look to your public health department too.